Hospice podcast. Today, we're going to talk about something that is very important for all of us, home health care. And we're going to go into every single detail as much as we can with the time that we have. And to help us do that, we have Maya Arguez, our director of social media marketing, and also my granddaughter.
Thank you for having me.
And she's going to help me. She's going to help me go through this podcast.
So let's start simple. Why don't you tell us what exactly is home health?
So home health is an extension. Actually, you can say that a home health is an extension of the doctor's office or the hospital or the rehab, because we're gonna send clinicians to the patient's home to assist them with something as simple as teaching them about their illness or how to take the medications, as something as complicated as to take care of a real bad wound where we need to use an apparatus that is called a wound vac, and we can do something as simple as that, as complicated as a wound vac, and everything in between. Catheter care, infusion care. We take care of people with COPD, CHF, liver failures, kidney failures. You name it, nothing is too simple nor too complicated for Avatar Home Health and Hospice.
Right. So the home health service is designed to promote recovery, prevent hospitalizations, and improve quality of life.
Right.
But a lot of people confuse home health with in-home caregiving.
Right,
so what
right,
is
yeah.
the biggest difference?
Yeah, well, home care has come along in the last, I would say, 10 years or so. That has become very popular, maybe a bit longer than that. And home care is really taking care of the patient or an elderly person. Actually, it could be a young person that has disabilities. And they take care of their everyday living necessities, like taking a shower, or they prepare a meal for the patient or for their client. Actually, sometimes just companionship or helping them walk around the block or making sure that the person is safe while the family, the caretakers, are away from home working or doing something that they need to do. And normally that is covered either by Medicaid or by the family or the person that needs the help paying out of pocket. So obviously, if the person is of low income and they qualify for Medicaid, it's a very, very good service if you qualify for it, because otherwise it can be very pricey, it can be expensive. Now, there's some exceptions. There's some policies called long-term policies, long-term care policies. So as the word long-term is there, that those two words are there, and you have that policy, of your mom or your dad have that policy, then that policy will pay for that care also. But in home care, there's no clinical care. There's no nurses, there's no nurses assistants, there's no physical, occupational, nor speech therapy, and there's no social workers, and it's not paid by Medicare, which is very important. And it's not paid by most commercial insurances. So again, when we talk about healthcare at home, whether it is home health, hospice, palliative care, and let's include this home care in the group, even though it's not really healthcare, but people get it confused. What I recommend if you have a specific question, if you want to know more about it, go ahead and call me. I'm going to give you my personal cell phone, and you can call me. That way you avoid talking to a secretary or receptionist or a medical assistant. You can call me directly at 281-703-8050. That is 281-703-8050. That's the same number that Maya calls me when she wants to talk to me about something, or my daughter or my wife. So I believe me, you call that number, you're gonna get me, and you can ask me any questions that you have. So I know that we're gonna give you a lot of information today, and some of the terminology or some of the things that I'm gonna talk about, maybe later on you go, oh, did he say this or did he say that? And that's the reason I give you my phone number. I don't want you to be bashful. Just go ahead and call me. I don't mind if you call me at all.
Right. So kind of going back to that. So what type of medical conditions are most commonly managed through home health with the medical team?
Well, actually, almost anything. You're talking about people, if people go to the hospital or their rehab and they come out and they still need more therapy. Mm-hmm. So we can provide them with with occupational therapy, physical therapy, speech therapy, any therapy they need. Also, let's say that the patient they kind of is forgetful, maybe not full-blown dementia or Alzheimer's disease, but patient is beginning to be a little bit forgetful. So the doctor wants to make sure that they're taking the right medications at the right time. So they send our nurse out there to make sure that they are taking the medications correctly.
Right.
So they teach the patients or the caretakers, because many times you have somebody else in the house, but they don't go, sometimes they don't go with the patient to the doctor, so they don't really know what to do. Mm-hmm. So when we go there, and the nurse will explain to them exactly how to how to give the medications, when to give the medications, and more important, what the medications are for. But so you also could have patients, like I said before, with a wound, mm-hmm. that needs wound care. They could have a problem with a heart failure, CHF, COPD, kidney, like I said before, kidney failures, anything, any kind of health problem that they're gonna need a nurse or a therapist to take care of them, mm-hmm. right? So that is very, very important. So
with that care plan,
yes.
That includes any pain medication management, that includes the wound management and all these services. But who determines what that care plan looks like for these patients?
Okay, so it depends. Normally, we get a patient from the hospital, a rehab, or a doctor's office. So whoever sends us that referral is going to give us like a prescription. Mm-hmm. And it's going to tell us what is wrong with the patient and what they want us to do with that patient. Like, for instance, a typical doctor's order is going to say, let's see, it would say something like, evaluate this patient for home health services and treat if necessary. Mm-hmm. Skilled nursing, physical therapy, occupational therapy. Now, when we get that order, and what we do, the process that we do is we get the order, we make sure that the order is signed, that everything is okay, and we check the insurance that the patient has, because we want to make sure we're going to get paid, and we want to make sure that if the patient has a copayment, that normally happens. Patients that are younger, mm-hmm. and they don't have Medicare nor Medicaid, what they have is like like a commercial plan with their employer or something. So we have to check because many times they're going to have a co-payment or a deductible, and we want them to be aware of it because they got to pay us that money directly to us.
Right.
But in our case, Avatar Home Health and Hospice, we specialize in geriatrics. So what does that mean? That means that we really are looking to take care of patients that are senior citizens, 65 or older. That's 99. If you look at our census, by the way, our census has grown to about 400 patients today. And if we include the hospice patients that we have and the home care patients that we have, that you mentioned before, then we're looking to close to 500 patients.
Right.
So, and I know this is not, maybe I'm not following your protocol
No,
there,
that's okay.
but then people might say, wow, 500 patients, so how do you take care of so many people? And really, number one, because we have what I consider, and of course, this is coming from me, which I'm a little bit biased, but I believe that we have the best trained and the best qualified staff of any other home health agency. Oops, by the way, Medicare doesn't like me to say that. I'm not supposed to say that we're the best. So let's say that we're one of the best.
Right.
All right? Not really, we're the best. So, and we have 150 clinicians. And when people say, well, they're all nurses? No, we have nurses, we have nurses assistants, we have providers, which are caretakers, by the way. We have physical therapists, occupational therapists, speech therapists. We have doctors, we have chaplains, social workers, nurse practitioners, and then we have the staff in the agency, in the office, that acts as a support to all those people that we have in the field.
Yeah.
So it's kind of a complicated. Avatar is very, very unique, and I'll get into it in a little bit.
So let's stay on that track. So what do you think sets the Avatar Home Health and Hospice team apart?
Well, besides being the best trained people, but the best trained nurses, I mean, our nursing program is unbelievable. When we hire a nurse, so let's say if I'm interviewing you, and you bring me a resume, I'm going to glance through a resume, and people might say, oh my God, you should really get into it. I see you got a college degree, and you got this experience, and you have the other experience. But home health and hospice is kind of very, very specialized. So we're going to have to train you anyways.
Right.
So what I want to know is, how compassionate are you? Are you here for a paycheck? Because if you're only here for a paycheck, we don't need you. I don't care who you are. I don't care what your resume says. We don't really need you. Now, if you tell me I have all this education and I got all this experience, but my main concern is to help other people. Now we're talking. Now I'm interested. Right? So number one, you have to be compassionate. Number two, you have to be willing to work with people that are low income, because we have all kinds of patients. We have people that live in beautiful mansions, those are the few. Then we have the people in the middle, and then we have the people who are very poor. And those are the people that need more help.
Right.
So if you come to me and say, well, like some people say, and again, keep in mind, you might be watching this in Miami or Maine or California, but we're in Houston, right? So if you say, well, like at one time we had a nurse and she had moved from out of state into Texas, and she was new in Houston, but she had heard that if you go to 1960, that is a dangerous neighborhood. Our nurses go everywhere, every place. We've been doing it for 20 years. We have never had a problem. We have never had a single incident. And she told me, well, listen, and but I don't go past 1960. I said, why not? Oh, that neighborhood, I have heard that is very rough neighborhood. I said, no, I mean, yeah, that neighborhood is not the best neighborhood there is, but our nurses go there all the time, and there are people that need our services, and we have to provide the services.
Right.
That is our commitment to the community. We don't pick and choose and say, well, we're going to take care of these people because they live in a nice neighborhood, and we're not going to take care of those people because they live in a bad neighborhood. There's no good or bad or we go wherever the patient is, right? So that's what we're looking for: compassionate and the willingness to serve.
Right.
And then on top of that, then after that, I'm gonna look at, yeah, okay, you're a nurse, you have experience doing this, you have experience doing wound care or infusion care, whatever your experience is, and then we're gonna bring you, if you're a nurse or a therapist or a nurse's assistant, we're gonna bring you into our training program.
Right.
So we just don't hire you and say, go see a patient, like some agencies do, which they should never do that. We're gonna bring you in. You're gonna be in the classroom setting for 3 days. After those 3 days, if you pass the classroom classes because it's like a, and we tell you up front, the fact that we bring you into training doesn't mean that you're gonna complete the training.
Right.
Because two things are gonna happen. You're gonna find out that home health is not for you or hospice is not for you, or you're gonna find out that you're not the kind of nurse or therapist or CNA that we're looking for.
Right.
Sometimes it just doesn't work. It's not a good match, right? So we go through the training in the classroom. If everything goes well, we take you out in the field and we do the field training with nurses who are experienced and they're qualified as trainers. So these nurses will take you through a training in the field, seeing patients. At the beginning, you see them, you see what they do. Then after that, they let you see the patients and they're gonna be watching what you do. After the visits, they give you a critique on what you need to improve. And as you improve, at one point, you're gonna say graduate.
Right.
And at that time, we do what is called a check-off. We check you off and we say, okay, you're good enough to go out in the field. Now, we might restrict the kind of patient you can see depending on what your strength and your weaknesses are. So let's say you say, well, I was exposed to the wound vac in nursing school, but I haven't. So I say, okay, no problem. When we have a wound care nurse patient that needs a wound vac, we're gonna bring you along and you're gonna see from beginning to end the treatment on that patient. And then we're gonna do it a couple of more times until you are ready for the task.
Yeah.
So our training is complete. And then we're ready to take care of any type of patient, like we said before.
So yeah, I think one of the things that sets us apart is that we do have one of the most extensive trainings for our nurses assistants,
Yeah.
and all of our clinicians.
For sure. Actually, a lot of the nurses go, like in the second day, usually happens on the second day of the training, they go, oh my God, but I never knew this. Oh, I didn't know why I was doing this. Because not only do we tell the nurses and all the clinicians that we train what they need to do, but why they need to do it. So they're not like a monkey that sees you do something that's repeated. They know that they have to do this because Medicare wants you to do it, and then this is going to be the kind of result that's going to happen because you're doing this way and not the other way. So they say, well, in the last agency I worked for, they gave me my nurse's bag and they gave me an address to see a patient, and they say, there, go get him. And I was out the door and I was seeing patients, but I had not received any type of training. So yeah, no one, and I can say this, whether Medicare gets mad at me or not, I can say this, no one trained the nurses the way that we do. Right. I put all the money in the world on it.
So another thing that sets Avatar apart is what, like you mentioned, the compassion we have for our community and wanting to go that extra mile, wanting to take that extra step. So one thing I think was a great example was Thanksgiving last week. We went and visited the patient. So why don't you tell us a little bit about that?
Exactly, yeah. So every Thanksgiving, and this started back, I don't know, 15, 16 years ago. By the way, let me say that we've been doing this for 20 years. So we're not new at this dance. So, or like they say in Texas, this is not our first rodeo. Had to throw that in. So I don't know, about 16 years ago, I'm talking about the poor patients, because that's, believe me, that's where my heart is. You know, if you're poor, you got my attention, because you need help. So like I said, we see a lot of things when we go out, and with the poor people, we noticed that, number one, some of them, more than you would like to say, they own their own, right? I remember when we first started the agency, we had a patient. When we first started the agency, we would take patients anywhere. If it was 100 miles from us, we were gonna take that patient, because we were hungry. We needed patients, right? So we had a patient in Galveston. That's like an hour and a half drive. So we went over there, we're doing the thing, we're doing the admission, and then we asked the patient, well, are you have a next of kin that you want us to? No. But you told us you had 3 children. Oh, yes. But do you want? No. I don't want them to know anything. I don't want even to know my phone number. So why? Well, they come here and they take my money and they take this, and then, of course, then on the other hand, you got people that are very well taken care of by their children. Don't get me wrong. But that particular lady, right? I bet you when it comes to Thanksgiving, she's eating alone. Yeah. If she's having a Thanksgiving dinner at all. So we took it upon ourselves to ask our nurses, if you have a patient that you know that's going to spend Thanksgiving alone, and most likely they won't have a Thanksgiving meal, a traditional Thanksgiving meal. We're talking turkey and mashed potatoes and gravy and the stuffing and, the cranberry sauce and the green beans, the good Thanksgiving dinner, right? You let us know, and we're gonna see to it that they get it. And by golly, the first year, we got 41. So we went ahead, and at that point, we used to be able to get the meals already packed. And not only did our employees, our staff, volunteer to take this to the patients' homes, but they brought their families. Yeah. So they went there and they actually sat with the patient and they heated the food up so they wouldn't eating a cold meal. And they sat with the patients if the patients wanted them to stay. And they sat with the patient while the patient ate, so the patient would not eat alone. Yeah. So that makes such a great impact on our employees, because actually, this is the beauty of the whole thing. And now I'm gonna get on my soapbox here a little bit. But when you give, believe me, you're gonna receive tenfold. And I think that's written someplace but that, it is true. So the first year we did this, I remember this member of the staff. She's still with us. She's been with us 17 years, guys, and that's not the exceptions. Most of our employees been with us for years and years and years. So she came back to me and says, "Mr. Felix, I'm so glad that I got to deliver that meal, because I brought my children, and my children saw that even though they don't have everything they want, there are people that have even less than they do. And when they left there, they wanted to help the lady more."
Yeah.
So that is the kind of culture that we have cultivated actually at Avatar. That culture of caring and that culture of giving. So going back to this year actually we did it last year too, we have added groceries. So we go out and we bring the meal, and on top of that, we bring a huge bag full of groceries. So we bring, macaroni and cheese and tuna and whatever I have. And the funniest one is a patient, somewhat. He was not a patient, by the way. The man, this guy named John. And John lives in Tomball. He's not a patient. And he called me and said, "Mr. Felix," I said, "how can I help you? You need nurse?" No. I don't need no nurses. I don't need anything. What I need is some food. I'm hungry. I said, "Well, John, don't worry about it. I'll help you. So what do you need?" He says, "I want some Spam." Imagine that. So I went ahead. I said, "Okay." So I bought John a case of Spam. Never forget, 4-ounce cans, like 24 cans. I don't know, whatever's in the case. And we took it to him, and he was the happiest guy in the world. And I never heard from him, So I hope that he still has some Spam left over. But I know that I digress. But it's important. I think it's important for people to understand that not only do we bring nurses and the therapists and so on, and we're going to take care of the patients in the physical sense, but we're going to take care of them, in the when they see that we care, that there are people out there that care for them more than that they're not a paycheck to us. That makes them feel good, because that kind of gives them hope,
Right.
and that's what we want to do. We want to bring hope to these people that have so much need,
Yeah. Well, and I think it adds to your confidence that the clinicians who are caring for you aren't just there for that paycheck. They're there because they care, because they want to be, because they want to go above and beyond for you and what you need.
Right.
So going back to what that looks like when someone is getting started with home health, what are some signs that someone might be ready for it?
Well, with older people, are the type of patients that we see. Number one is forgetfulness. If they start forgetting things, that's a red flag, because they're not taking the medications on time. They might cause an accident. The house might catch on fire because they turn on the stove and they forgot to turn it off. And before they know it, you got a fire going, and they panic and they don't find the door, and then they make the news, which is something that we want to avoid. So forgetfulness, lack of appetite, or overeating, high blood pressure, diabetic. Like if you have diabetes and it's uncontrollable, you need professional help, because you might die.
Right.
Lack of, short of breath. So, almost anything. The reality is most people, as we age, our health start giving us problems, right? I mean, there's no denying it. Even though today they say, well, today's 60s is yesterday's 40s and all this stuff. Hey, when you're 60, believe me, you're not 40. I don't care how much supplements you take. I don't care how much exercises you do. You're not. When you get 65, you're getting further away from 40. Believe me. So and so on and so on and so on. So keep in mind that today people are living longer.
Yeah.
When we first started the agency 20 years ago, we had maybe one or two patients that were 99, 100, something like that. Today we have a bunch of them.
Yeah.
The other day I was talking to a patient, 102 years old. She's more lucid than I am. She was talking to me about the things in the childhood, and I was so impressed. I said, "Are you sure you're 104?" And she said, "Yeah, I'm 104."
Right.
You know, so, but our health started failing, right? And she's a good exception,
Yeah.
but she's very healthy. But most people, as they get old, things that start showing up. Arthritis, right? That's very typical. Arthritis, heart problems, and a lot of it, of course, is genetics. You have to look at your past. Hey, in my family, I can talk about my family. On my mother's side, you had a lot of cancer. So hey, guess what? I had prostate cancer.
Right.
Did it surprise me? No. Was I upset? Yeah, who wants to get a prostate cancer, right? But thank God and thanks to science and the Lord, I went through radiation treatment, and I should be fine now. But there's cancer. There's so many things. But again, what we do recommend people is, if you have a loved one and they're old and you see that they have problems ambulating, that's another thing. They can't get out of the chair. They go 1, 2, 3, like they have to rub themselves a few times before they can leap out of the chair. They have fallen, and then they're going to refuse, because this is what happens. As people get old, they're old, but they're still proud.
Yeah.
So they don't want to use a walker. They don't want to use a cane, and then they fall again.
Yeah.
And then they fall again. So if you see if your loved one has fallen one time, take him to the doctor. Say, "Doctor, my dad fell." It doesn't matter if your dad says, "No, but that was only one time." It doesn't matter. Let the doctor know that he fell. So, but yeah, those are some of the signs. But but for sure, if you're older, you should be going to the doctor at least every 6 months. And then once they find something with you, the doctor's going to tell you how often you need to go to them. And eventually, believe me, write this down, because this is as true as we all have to pay taxes. Eventually, you're going to need home health. Eventually, you're going to need hospice. So write my number down, 281-703-8050, and call me with any questions you might have.
So if someone is kind of picking up on those signs, is that the
Right.
best next step to call you, go see their doctor?
Exactly.
And what happens from there?
Okay, so let's say they call me. They didn't see the doctor, but they call us, right? So I'm going to ask them a few questions, and what we're going to do is we will send a nurse out to see them, or I can go out to see them, even though I'm not a nurse, and I have a conversation with them, and then we might ask the doctor to send us an order for home health. Also, that could also happen with hospice, by the way. We can ask the doctor for an order for hospice. So in many cases, the doctor's going to say, well, before I write the order, I want to see the patient. So we tell the patient, make an appointment, go see the doctor. And then after that, the doctor's going to send us the order. Maybe the doctor sees the patient and say, well, he's not hospice ready yet. Let's put him in home health. And we go ahead and put him in home health. And maybe they don't need hospice, but maybe they do. So as the time goes by, our nurses are keeping an eye on them, and they will make a recommendation for the doctor. And when we see the patient, we come up with a plan of care. and that plan of care is sent to the doctor. I said, doctor, I know that you call for a skilled nursing and physical therapy and occupational therapy, but the patient is having problems swallowing, so he needs speech therapy too. So then we have to wait for the order because there's nothing we can do without a doctor's order. So in other words, we always have to count on the patient's doctor. And then they send us the order, the new order for speech therapists, and then we include that in the patient's plan of care. So everything is done with the patient, the family, and the doctor, and our nurses. So it's kind of a group kind of thing. But of course, the patient, I mean, not the patient, but the doctor always have the last word on what we need to do.
Okay, so let's go through a few quick questions that we get pretty often. Is home health covered by insurance, Medicare, and Medicaid?
Yes. So home health is going to be covered by Medicare for sure, by Medicaid for sure, and by your insurance company. If you have, like, say, an Advantage plan, like a lot of people over 65 have, if you have Medicare, they talk you into getting an Advantage plan. And in some cases, it's the best thing for you to do. In some cases, it's the worst thing for you to do because it really depends on your ability to pay premiums or not pay premiums. That's what it boils down to. So you got to be careful though, and that's why I hesitated, because you're covered, but there's a lot of buts, because it depends on your insurance company. If you let an insurance company take care of your Medicare benefits, then the insurance company is making some decisions that normally your doctor and yourself should be making. So, but then again, you got the money problem. So it's kind of like a slippery road. And no matter what you do, you might be in trouble. But basically, yes, they will be covered. But the best thing to do, again, you call me at 281-703-8050. Call me, and I can tell you what your insurance company covers. And I can tell you what kind of insurance coverage you have. And if it's not going to cover for home health, and that's the problem that we're having now, a lot of plans are minimizing the kind of home health care you can get. And that's awful because you're going to need home health. So you need to know ahead of time, and maybe I can tell you, hey, don't keep this policy, go to this other company, or talk to an agent from that other company. They have better coverage for you than this company does. So always it's smart to call me, for sure.
Okay, so next question. How often should they expect clinicians to be visiting their home?
So typically a nurse will go 1 or 2 times a week. If they need a CNA to help them take a bath and so on, they're going to go 2 or 3 times a week. A physical therapy, any therapy they get is usually going to be twice a week. So on a normal plan of care, let's say they get in the nurse once a week and physical therapy is twice a week, that'd be 3 visits a week. Sometimes they get, it depends on the needs of the patient. Sometimes they might get 10 visits a week. It all depends on the needs of the patients.
And then last question, how long does home health last?
Well, home health, as defined by Medicare, is an intermittent service. Intermittent. It goes on and it comes off. It goes on and off. So that means that we're going to keep you in home health, usually for a month, 2 months, 3 months. It needs to be until you reach your maximum potential or you reach your goal, one of the two. Sometimes it's that no matter what we do for you, you're not going to improve. And in that case, there's a decision to make. Is this patient a forever patient, which is not much, there's not a lot of chance that you're going to be a forever patient because Medicare doesn't want the home health to be forever. So we have to we have to monitor that. But yeah, so it's normally 2-3 months. Then we'll discharge the patient, and then because the patient is at this age and it's got these conditions, the patient is going to need us again, and they're going to go ahead and call us, or they're going to go to the doctor. The doctor's going to send us another order, or whichever way happens, we go back to the patient's home and we start taking care of them again.
Perfect. Well, if they want to learn more, they can find Avatar Home Health and Hospice on Instagram, on Facebook, on LinkedIn, and on our website at avatarhomehealth.com. And then do you want to give them your phone number one more time?
Yeah,
so
my number is 281-703-8050. I'm Felix Cannibal with Avatar Home Health and Hospice. Maya West is our Director of Social Media Marketing. And we've been doing this for 20 years. We cover all of Harris and Montgomery County. And please, stay safe. Christmas is upon us. And we want to get you ready for Christmas. If there's anything wrong with you, please give us a call or look us up on our webpage or follow us in all those places that Maya told you about that I haven't learned how to say them yet. But yeah, please. But we want to thank you. Once again for being with us. We're going to be doing one podcast every week, and we're going to have a lot of quick information pieces on the social media. So once again, thank you for joining us, and we'll see you soon.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube.